Hello medicos. So in this lecture we are going to discuss about the front of the thigh. So let's begin with the superficial fascia. The superficial fascia of the thigh. See, I have marked this in green color. Uh, this has two layers. It has two layers. The first layer is a loose layer, which is superficial fatty layer. Okay. And secondly, we have a deep membranous layer. The green I have marked here, this green marking, this is the deep membranous layer of the superficial fascia of the thigh, and it has fat molecules over it. Okay, so this deep fascia, deep membranous layer, is attached to this abdominal fascia. Okay, it is firmly attached to the abdominal fascia. And there is a line of demarcation in between them. See, this one is the line of demarcation in between them. Okay, this line of demarcation is known as the Holden's line. Okay, Holden's line, or the fold of groin. This starts from the this one, just little lateral to the pubic tubercle. This is the pubic tubercle. This is the pubic tubercle. It starts just lateral to the pubic tubercle, just laterally. And it ends here in the lateral aspect of the thigh. Okay, so we are done with the superficial fascia. Now what are the contents of the superficial fascia of the front of the thigh? It contains cutaneous nerves, then superficial veins, superficial arteries, and superficial lymph nodes. Okay, so what are the cutaneous nerves of the front of the thigh? So let me mark it. It has a lateral cutaneous nerve of thigh, it has an intermediate cutaneous nerve of thigh, and it has a medial cutaneous nerve of thigh. And another one, there is a femoral branch of the genitofemoral nerve. Okay, this is the femoral branch of genitofemoral nerve, lateral cutaneous nerve of thigh, this is intermediate cutaneous nerve of thigh, and this one we have medial cutaneous nerve of thigh. Now let's come to the superficial cutaneous arteries, or the superficial arteries. This one is the femoral artery, which is a deep artery, not the superficial artery. There are few branches of the femoral artery which lies superficially. There are 3 superficial arteries. This one, superficial circumflex iliac artery. Then we have superficial epigastric artery, and we have superficial external pudendal artery. Now let's come to the superficial inguinal lymph nodes. While we talk about the superficial inguinal lymph node, there are 3 major group of lymph nodes. Okay, 3 group of superficial inguinal lymph nodes. Those are: number 1, lower vertical group. Number 2, upper vertical group, and number 3, horizontal group. See, the lymph nodes are present here. Lower vertical group, okay, and there are upper vertical group, and there is a horizontal group. Now see this. Okay, this one is the upper vertical, lower vertical, and this is lateral horizontal, and this one is medial horizontal. So we are done with the cutaneous nerves, we are done with cutaneous arteries, superficial inguinal lymph nodes, and now let's go to the superficial veins. Okay, there are 2 major superficial veins, the great saphenous vein and the small saphenous vein. But in the anterior of the thigh, we only find the great saphenous vein, so we will be discussing the great saphenous vein here. So this is the great saphenous vein. I'll be dealing with it in the venous drainage of the lower limb, so I won't be going into details. It starts from the dorsal arch. This is the dorsal venous arch, and from here, in the medial side, the great saphenous vein starts this way, medially, and it reaches the popliteal fossa. Then it enters the saphenous opening. While it is draining into the femoral vein, it has 3 tributaries. These tributaries are superficial, epigastric vein, superficial external pudendal vein, external pudendal veins, and this one superficial circumflex iliac vein, superficial circumflex iliac vein. And this one, you know what is this? This is the great saphenous vein. Similarly, this one is the great saphenous vein. And these are the tributaries. So we are done with the superficial fascia of the anterior aspect of the thigh. Now let's go to the deep fascia. The deep fascia of the thigh is also known as fascia lata. Okay, fascia lata. You might have heard about this name, fascia lata. So it has 2 extents. I'll be dealing with it. Superficially, it is attached to the boundary line between the lower limb and the pelvis. See, this is the lower limb and this is the pelvis. Okay, this is the pelvis and this is the lower limb. The superficially, it will be lining this way, in this way. Okay. So what is the superior extent? The superior extent is superficially it lies to the boundary line between the lower limb and the pelvis, between the lower limb and the pelvis. And inferiorly it is attached to the knee. Okay, inferiorly it is attached to the knee. See, in this way, and this picture, this is the knee, and this fascia lata starts from here and it gets attached on top of the knee and the sides of the knee. Okay, so what is the inferior extent of the fascia lata? It is the sides of knee. Okay, sides of knee, or you can also say the capsules of knee joint. The deep fascia of this thigh has 3 modifications. The first modification of the deep fascia is the iliotibial tract. The second is the saphenous opening, and the third is the intermuscular septa. Now let's discuss what is iliotibial tract. See, Normally we have this fascia lata all over our anterior aspect of the thigh, right? But in this area, in the lateral most area, this is thickened. Okay, this fascia is thickened and it forms the iliotibial tract. So what we are going to write? So we are going to write that it is a 5 centimeter wide band. Okay, it is a 5 centimeter wide band. See, this is 5 centimeter wide band which has an extent from the superior to inferior extent. Okay, superiorly it arises from the gluteus. Okay, wait. There are two muscles. Let me tell you. Gluteus maximus. Sorry. Gluteus maximus. Yeah. Gluteus maximus and tensor fascia lata. There are two muscles. Tensor fascia lata. The fascia covering it, these two muscles, the fascia covering these two muscles extends below. Okay, extends below and it gets attached to this area. This area is known as the Jurdy's tubercle of tibia. It's known as Jurdy's tubercle of tibia. Okay, so it is thickened. The fascia which holds this muscle. Okay, so basically what is iliotibial tract? Iliotibial tract is a modification of the deep fascia of the thigh which holds the gluteus maximus and the tensor fascia lata muscle together, and this gives us a support laterally. Okay, it is present in the lateral aspect of the thigh. Next is the saphenous opening. See here, this one, this area, this is the saphenous opening. The saphenous opening is wait, let me tell you. The saphenous opening is an oval opening on the anterior aspect of thigh, through which many vessels drain fluid into the deeper vessels. Okay, just like we have learnt about this femoral artery through which the superficial external pudendal veins, superficial external pudendal artery, then superficial epigastric artery and the superficial circumflex iliac artery emerge. And we have also learnt about the femoral vein, where the great saphenous vein drain the venous blood, and there are three tributaries of the great saphenous vein, same superficial external pudendal veins and the superficial epigastric veins and superficial circumflex iliac veins. So there is an important point about the saphenous opening. If you are asked to show where is the saphenous opening, you have to show that it is 4 centimeter below and 4 centimeter lateral to the pubic tubercle. Okay. Next, the next modification of the deep fascia is the intermuscular septa. What is the intermuscular septa? The intermuscular septa is the septa which divides the muscles of the thigh into different compartments. Okay, so see, this is the anterior. Wait. See, this is the deep fascia, and let us take the example. This side is your lateral side. Okay. Laterally we have iliotibial tract. So this deep fascia, this deep fascia invaginates into the muscular structure, and it gets fused to the linea aspera of the femur. Here is the linea aspera of the femur, and it gets fused to the linea aspera of the femur, forming various compartments. See, this is the anterior compartment, this is the posterior medial compartment, and this is the posterior lateral compartment. Or we can also say this is the anterior compartment, this is the medial compartment, and this is the posterior compartment. Okay. So this septa is known as this one, medial intermuscular septa, medial intermuscular septa, this is the posterior intermuscular septa, and this one is the lateral intermuscular septa. And now let's talk about the compartments. This is the anterior compartment of thigh, this is the posterior compartment of the thigh, and this is the medial compartment of the thigh. One more thing, this anterior compartment of the thigh is supplied by femoral nerve. Okay, posterior compartment is supplied by sciatic nerve, and the medial compartment is supplied by the obturator nerve. Just keep in mind, I'll discuss it when we study about the individual nerves. This is obturator nerve, this is sciatic nerve, and this is femoral nerve. Okay, so we are done with the superficial and the deep fascia of the anterior aspect of thigh. I hope you like it. Thank you. Bye bye.